What is a silent mentor? Many people know that organs can be donated after death. But do they know that the body can also be donated for medical studies? Body donation enables medical students to carry out simulated surgical training, to study about the nervous system, blood vessels, the heart, liver, spleen, lungs, kidneys, and so forth, to let medical students make their first surgical cut. The medical community honors a body donor as teacher of the body, or silent mentor. A silent mentor teaches without speech. Students would perceive the value of life and recognize the meaning of death. Before their passing, a silent mentor has voluntarily given consent, pledging their body as a selfless offering, leaving the world with great compassion. Their students would learn that a patient is someone's father, mother, or child, someone who has worked hard and sacrificed for the family. They would realize on the surgical bed what a patient needs most is to be treated with compassion. There is no room for mistakes.
马来亚大学医学院秉承台湾慈济大学大体老师捐赠的人文教育理念，加上肖恩集团鼎力支持，经过2年筹划的模拟手术中心，终于在3月23日正式启用。马来亚大学医学院模拟手术中心的成立，广受马来亚卫生部和医学界的支持与好评。
It is my pleasure to officially announce the launch of Miles Skills Training Center of UMMC for an initial 3 years, making this hospital the first in Malaysia to achieve this distinction. A hearty congratulations and thank you very much.
马来西亚有相当多的华人，那慈济人也相当的活跃，那对这个遗体捐赠的理念，那也都非常的坚持等等。所以我个人看，这一个马来西亚非常可能是第一个国家真正这样做，而且很可能是第一个国家他做得出来。
The Silent Mentor program conducts 3 surgical simulation workshops every year. These workshops are opened to medical specialists, trainers, and students. It provides hands-on training on the human anatomy for medical students.
Credit point is not granted to students as this is a voluntary program. Even our lecturers take part in this program are also voluntary. They contribute their time in lecturing without getting any reward from the university. This is obviously very different from the way Tzu Chi University organize it. At the initial stage of program launching, there were limited sources of donated body. When the first silent mentor workshop is organized, we directly approach targeted clinical year students to join silent mentor program after 5 p.m. in weekdays to attend the lectures and hands-on session. We use this approach to invite students to join silent mentor program in the initial stage, coupled with the recommendation by their seniors who have experienced the silent mentor program earlier and encourage their juniors to grab the opportunity to join the program as well. Gradually, after operating for few sessions, we did not need to approach students anymore. Interested students will come forward and approach us for silent mentor program.
The Silent Mentor program, it provides hands-on training on the human anatomy for medical students. Students would pay a visit to their silent mentor's family to learn about their mentor's life story. They would write a biography. They would clean up the body day and night, hold a gratitude ceremony, and dress up their mentors for the final send-off journey.
The students are learning not from a book or a model, but from a person, a teacher who does not speak a single word. We commonly teach the students through lectures, presentations, but with this silent mentor model, the students will have to feel or experience by themselves this act of kindness by their mentors.
所以他们是传统一的，全都是马达声。那么我们就会花2个小时让学生去了解他们的大体老师。The objective of interaction is to enable communication between students and family members, collection of history of patients, understand the relationship of family members with the patient, as well as the relationship between patient and community. Our focus is on holistic health care. It means that we are not just looking at the physical medical issue of the patient, but the overall well-being of patient in a more humanistic approach.
大体老师奉献自己的精神是最值得我们去学习的。
I hope the students was taking advantage and learning from my body. If they make a mistake through it, don't worry about it.
Chest tube 就是把一个管道放进去肺里面，但是在真正在学校在医院的时候是很难有这个机会去让我们去实习的，而且也不简单做的。
I don't feel any more pain. Just redo again until you can perfect it, so that you won't make the same mistake on a living thing.
这是我第一次用手术刀来开在病人身上，也开在吴宇老师的身上。起初还蛮下不了手，部分是因为害怕，部分是因为认识大体老师，认识他的人，要割下第一刀不是这样简单的。我心里也有想，大体老师我要开刀了，谢谢你的贡献。
So make sure that every time when you make an incision or cut on my body, don't ever worry that I'll be painful, and don't ever worry that I will have any grudge on you, because I'm not around anymore. So just make the full use of my body. I hope that you will learn better from there. So I would like to congratulate you, whoever have done on my body, that you will learn more and then keep all the knowledge and make sure it stays in your mind every time, and remember me when you do the same operation on the same spots on your future patients.
Hi, my name is Rafi. I'm currently working as emergency doctor at Universiti Malaya Medical Center. I still remember I joined silent mentor program in the earlier its establishment at Faculty of Medicine, Universiti Malaya. At that time, there were mixed reaction about the program, but personally, I think it's a good program. It provides a good platform for future doctor, including me at that time. It gave us an opportunity to produce invasive procedure to a patient. So in future, we can provide or avoid risk in real patient. Of course, by doing so, it makes us more comfortable, confident, and capable in the early stage of our training. And then maybe some of us can say this practice can be done in mannequin, but I beg to differ because I think what I'm experienced is irreplaceable. Because I think silent mentor just not touch about clinical part, but we also go to patient homes and families, and then where we share stories and then learn about each other. Then it made me realize that medicine is not about patient and disease, but it's also about the carer and the family members who share the similar burdens. So it makes me more empathic and tolerant toward the patient that I'm dealing in the future. I hope community continue to understand the programs and the benefits, so it can grow throughout the nation to produce a better doctor.
我是佩文，我是毕业于马来亚大学医学系，现在我已经是一名内科专科医生， 正在进修安宁疗护这个专业。那么我是10年前，2012年，吴语良师第一批的学生，有怎么样的体悟？它到底是否对我在行医的这10年，有埋下了影响？那我很肯定的说是有影响的。那它的影响是很深远的，甚至是于不知不觉之中，有很多的努力来自主办方，怎么的去让学员们在整个吴语良师的计划当中，去认识我们眼前的这一位吴语老师。那么我们在临床中，我们就变成非常专注的去看，这个病人有没有这一个症状啊？这个病人有没有这一个病理上的显现呢？可是往往呢，我们会连接不起来这个人，我们在看着这一位病患，他的这一个人的感受是什么？他在他的生活中，他的家庭中，当他生病了，他有什么样的困难？所以这些的种种会让我们变成医生只是很机械化的在咨询着你有什么身体病理上的问题，可是我们却忽略了他其实是一个人。这就是为什么人文医学是这么的重要。若是你加了一些人情味下去的时候，这就好像你煮菜所有佐料，你一加下去了，整个治疗过程，整个医生病人的关系其实是更温暖。你所给予的治疗方案其实是更加活起来的，更加贴近病人与家人的需求。所以我觉得人文医学的确是一个非常重要的基石，给予每一位医学系的学生。
Hi everyone, I'm Evan, currently the final year master student trainee in ophthalmology department. I'm actually introduced firstly to supplemental program Universiti Malaya since I was undergraduate in Universiti Malaya. I was given the chance to actually join supplemental program twice. Once during my medical school time in 2012 and another once during my master journey in 2019. So if you were to ask me, what is the main gain that I could benefit from supplemental program itself, I would say it's just not surgical skills and training through the simulation surgery, but humanity. Humanity is the key message that I can gather and gain throughout my experience from supplemental program, from all the mentors that I have been with. I was lucky enough to get into this supplemental program since my medical school time. It actually teach me to learn and to communicate with the patients as well as their caregiver better in a sense. At that point, I was not really medical equipped yet with enough knowledge, but this is the main key messages that I can get and gain from the first experience in supplemental. And as compared to my second time in 2019, when I came back as a master training for my specialization program, I do learn, other than humanity itself, I learn more from the surgical skill as well as training via the simulation surgery on all those methods. From here, I learned to actually treat the patient as a whole, not by just seeing them as a disease. Understand them, knowing their sufferings, and what are the indications for them to come to see us. Talk to the caregiver, get more information from them can help to actually plan for the management as well as the treatment outcome. And I always believe by listening to the patients and their caregiver can help to reduce the suffering by half. And at most time, the treatment outcome is very promising because they are confident in you and they have faith. This is a difference that I can say or I can tell throughout my training for the past years as compared to my other colleagues. So I would like to take this chance to actually express my gratitude to all the body donors out there for their spirit of great love as well as their aspiration to help nurture young doctors and juniors out there. Thank you to the caregiver as well to help fulfilling their wish. And thirdly, the team led by Prof. Soe for their perseverance as well as their effort into organizing silent mentor program without failing. Congratulations to Universiti Malaya Silent Mentor Program for their 10th anniversary. I hope this program can be continued for years coming for all those more and more medical students as well as the juniors trainees. And I will say I will come back as a contributor as well as a trainer if they ever need me.
I come from India. I'm a oral and maxillofacial surgeon who does a lot of teaching exercise also for students, medical and dental students. So the experience that I saw here teaching in the University of Malaya with the Silent Mentor program was amazing. It was a big eye-opener for me. And the program that I saw where the dignity of life even after death and the dignity with which the silent mentors, which are the patients who have voluntarily given up their body for medical purposes, is an amazing story. And one particular patient, when I sat and listened to the story this morning, was so impressive. She had said,
我希望他们比较有爱心咯，耐心咯，来看病人啊。希望他们学了更进步，更会救人咯。在那个实体身上可以千刀万刀，都不能再生病的身上戳一刀。
It is better that 100 wrong cuts are made on my body rather than someone make one wrong cut on a living patient. And that was her whole mission in giving up her body for medical research and for medical training. This spirit, I think, must be encouraged so that the quality of education, the feeling of empathy for a medical practitioner and a student towards patients gets more and more. The compassion and empathy as medical practitioners will definitely be strengthened by this mission of the silent mentor, which started off from Taiwan. I really pay my greatest respects for this, the patients, their families, and for the Silent Mentor program. I hope and pray the movement goes and catches up all over the world. Thank you.
栽培具备人文素养的医务人员，灌输社会大体捐赠的正确概念。马来亚大学吴以良师中心荣获2017年第4届陈嘉庚精神奖。
吴以良师不管是在医学上，就对大体的尊重，对于人类的人的尊重呢，它是一个很好的典范，它是有前瞻性、有长远的意义。
大部分的团队成员都是 volunteer， 在得到这个奖、这个精神奖以后，能够向他们表示，就讲社会人士认同我们这个计划，他们所做的贡献都是被人家都看重。我们真的是很希望通过这个陈嘉庚精神奖，能够让另外各种不同阶层的民众能够明白，能够听到这个吴以良师计划，从此能够更有效的为这个社会提炼更多有素质的医生。
荣获陈嘉庚精神奖，对马大吴以良师中心团队是一个肯定，更是持续推动计划的动力，号召更多的有志者加入，发扬吴以良师的大爱精神。
The Silent Mentor Center was established by the Faculty of Medicine, University of Malaya in 2012. Our goal is to enhance the standards of medical education through humanistic elements. Since then, we have received more than 120 donors and performed 29 simulation workshops, benefiting thousands of medical students, both locally and abroad. These achievements would not have been possible without the selfless acts of the silent mentors. To express our gratitude and commemorate their great contribution to medical education and humanity, the corridor outside the Silent Mentor Center is now called the Great Equanimity or 大舍 Corridor. This is a place where family members of the silent mentors could remember the final wishes of their loved ones. It is a place the public can explore and understand the altruistic purpose of body donation for medical education. A silent mentor's body donation does not signify the end of life, but it is a gift of one's life for the benefit of humanity.